questions. So I'm going to talk about problem mares and specifically looking into the symptoms we see in the problem mare, understanding why we see the culture negative swaps, why and how to detect the dormant or also called sleeping Streptococci, and we'll end up in my brief contribute looking into the treatment protocols. And one of the issues with the problem mare is that it can be difficult to identify the problem mare before it actually is a problem mare, and the reproductive history of the mare can, in a lot of cases, help. Events like pregnancy loss, how the foalings went, and whether there's been retained placenta or not, can be issues that is helpful in identifying a potential focus area. But also the reproductive efficiency in the previous years. We have worked a lot with these chronic infections, and one of the major risk factors are previous infections. And it's a common scenario to see that the mare has had an infection in the previous years, but was treated and got in foal, and that maybe has happened once or twice the following years, and then all of a sudden the mare does not become pregnant. As an aspect to consider is also the stallion fertility, and if you, for example, have a 60% pregnancy rate, just to do the math, 94% of the mares will be pregnant following 3 cycles. But if you only have a 30% pregnancy rate, then those figures will be 66% of the mares pregnant following 3 breedings. And just as a way to remember that stallion fertility, of course, also has an impact on the overall fertility. If we focus on the uterine aspects, focus on these mares that are susceptible to infections, what characterizes these mares is the reduced capacity to clear the uterus, predominantly due to decreased myometrial activity, but also a decreased lymphatic drainage, because the lymphatic vessels do not have a muscle layer, and then they are dependent on the myometrium to help clear the lymph system. Another aspect is the deficient or delayed local immune response that is seen following breeding, and if there is presence of bacteria, yeast, or fungi. In a fraction of these mares, we cannot culture anything. Bacteria are easily identified if they are active. If they have an active growth and they are multiplying, then you can transfer them to the culture plate and they will continue growth. It's more problematic if they are non-active, dormant, or sleeping. Then it can be difficult to demonstrate the presence simply because they won't grow on the culture plate. What we have worked on the most is the activation, identification, and treatment of latent or dormant Streptococci. And it's a very simple approach, and you don't need any other tools than you are using already. You are sampling the uterus before you add the 10 mils of Bactivate by uterine installation, like you would treat a mare with antibiotics, for example. Then you come back 2 days later and do another sampling. Because if you have a sample before and after activation, so when you have a sample before and after activation, you will have an idea about whether there will be dormant Streptococci in the uterus or not. And when you have the culture result 24 hours following the last sample, you can start treating. And because you know which bacteria you have identified, you can have an optimal treatment. And we recommend, if you have identified dormant Streptococci, then treatment should include a local treatment with antibiotics and lavage, but also a systemic treatment with antibiotics, because the bacteria can be localized up to 1 centimeter, or about a little bit less than half an inch within the tissue. And it's impossible to have concentrations of antibiotics that deep without a systemic administration. So what have we learned in the last 10 years? What characterizes these chronic infections is that it's a wear and tear result. So mares that have been exposed to bacteria during breeding or foalings over the years will collect these bacteria and become chronically infected. And we looked at problem mares predominantly, and if we look at we had very solid data set on 400 mares, and if we look at these problem mares, and what characterizes these mares is that they are more than 12 years of age, they have had more than 3 foals, and they have a history of endometritis. So if you have a problem mare and it's either more than 12 years of age, have had more than 3 foals, and or has a history of endometritis, then there's an 80% risk that that mare is infected with dormant Streptococci. So a variety of uterine treatments is out there. And one thing, as a vet, we have a tendency to focus on uterine issues, but it's important to say that the uterus is nothing without a mare. And I've seen a lot of mares over the years that I'm sure only got pregnant because they were fed the right way, they were managed the right way, and that shift in environment allowed them to become pregnant. It's important to do the diagnostic workup and identify the problems. And it might initially look like something that is very expensive and you have to put a lot of money in diagnostics, but it's money saved in the long run. And then the aim is to address the problem. So is there an infection present? Is the infection active? If it's not active, then there's no effect on the antibiotics. If there's an issue in uterine clearance, then decrease the exposure time to sperm, lavage the uterus following breeding, and help clear the uterus, for example, using oxytocin. And in a lot of these older mares, there is perineal conformation issues, and then a Catholic is also indicated.